Hello, everybody. It's Monica Heltz with your daily Fishers Health Department update. Today is Tuesday, September 15th. So, since it is Tuesday, we'll do our weekly community risk rating scale review. I will save you the suspense and just tell you we're going to stay in yellow. And then I'll go through the metrics with you. So, we're going to continue in our risk rating level yellow. Our county percent positivity right now is at 5.6%. Our Fishers Health testing site is at 5.08%, and our case incidence rate for Fishers as a whole is at 15.99. So no real changes in any of those. Again, the percent positivity continues in our yellow zone. Our case incidence rate continues in our orange zone. It's hanging steady for the most part on that 14-day average. It's been bouncing between 15 and 16, so no major differences there. So we're going to just keep ourselves in yellow. Again, those are our primary metrics that we consider. And then if we're concerned about which way we want to go between yellow and orange or green and yellow, then we look at these secondary and tertiary measures. So our secondary metrics, again, are having to do with testing availability and contact tracing. So our availability for testing right now is quite good. At our Fishers Health Department testing site, you can get tested the same day or the very next day. We still have appointments available every day. We are not at capacity right now, and we are planning, again, to increase that capacity very soon. So the testing availability is good, and that seems to be the case kind of in the area or the region as well. Our testing turnaround time is also very strong. Right now we're looking at less than 24 hours. So most people, if you're tested on one day, you'll get your results probably first thing in the morning the next day. It may be a couple hours later, just depending on where your sample was batched, but it's been quite frequently less than 24 hours, so that is quite good. That seems to be the case around the state as well. When I crunched some of the data from the other places to see how long it was taking for reports to get to the State Department of Health, it was taking between 1 and 3 days, but it was an average of only 0.8 days. So that is quite fast. That's a definite marked improvement from what we saw previously. So those test results are getting transmitted quite quickly to the State Department of Health, and that is helping the contact tracing efforts. As far as how long it is taking to get people interviewed for contact tracing, it is taking an average of 1.43 days between getting the report and getting interviewed. So that means about less than 2.5 days from getting your test done to getting interviewed. So it's not great, but it's not terrible. That puts us kind of in the yellow zone on that. And that's for all of the data for Fishers residents, not just our Fishers Health Department testing site. For our site, we're able to notify people typically the same morning or at least the same day that the results come in. So it's an even tighter margin. Now, the other thing I wanted to point out with this is when I calculate which percentage of people are actually participating in the contact tracing, only about 50% of people are even getting interviewed. So that doesn't count the people that are interviewed and then they neglect to do contact tracing. But only 50% of people right now are getting interviewed at all, 50% of Fishers residents. So that means we can't do contact tracing. So it is really important that you try to participate in this process. And if you get a call from us or the State Department of Health, please do answer that call and help us with these efforts so that we can continue to keep our community safe and continue to make this a safe environment for our kids to go back to school in. So as you know, HSE 5th through 12th grade is going back on Thursday in a hybrid model, and our kindergartners have already been back, and kindergarten through 4th. So we want to keep all those kids and all those teachers and all our community members safe from COVID as much as possible. So please help us by getting tested if you need to be tested, quarantining if you need to quarantine, isolating if you need to isolate, and participating in the contact tracing process. We know this is the key to getting ahead of this. As far as our tertiary metrics, so just kind of the things that we lightly look at that are just slightly informing what our recommendations are, those would be our hospital data. Right now, Hamilton County looks really good, but Region 5 as a whole is, I would say, generally inconclusive. So we look at Region 5 because that would be the whole area's hospital system that most of us would participate in. Right now, the emergency department admissions and deaths are kind of an inconclusive stage, so we can't tell if they're going up or down. ICU admissions, however, are on the rise, so that is a little bit concerning. We'll keep an eye on that. The only other thing I wanted to bring to your attention is that we have had a few cases recently in our long-term care facilities. We haven't had any clusters of cases or an outbreak, but this is concerning. So please do use lots of extra care if you happen to be visiting a long-term care facility or work in one. Thanks so much for listening.